The fact that people think that they have or they do not have hormonal abnormalities is a huge misconception because we don't know unless we are measuring it. I have patients coming to the office and they are fatigued. The whole three symptoms, three friends: brain fog, fatigue, weight gain. And I check the thyroid, and they come and say, check my thyroid. And I check the thyroid, and everything is normal. And I say, your symptoms exist, but it's not related to your thyroid. But there are so many other things that may cause that. Okay. So the misconception is thinking one symptoms or two symptoms are related to only one disease, which is not true. It could be anything causing those symptoms. Those three amigos, they are commonly happening with many of the endocrine disorders. And other misconception about the hormones, the big one actually, is post-menopause hormonal replacement. Because a few years back, when they prematurely announced that hormone replacement can cause cancer, cardiac death, all women, they got scared. They avoided to be on hormone replacement. And obviously, there were so many complications of lack of hormone replacement post-menopause for that group of women. We saw it later on in our offices. But now that people know that hormone replacement, what is the complications, potential side effects, and what are the benefit. And with having those knowledge, the right population are the perfectly fine to start to be on hormone replacement. Same thing for men. Only changes in the sex drive is not something that can be alarming for low testosterone. But there are so many things that men can experience with low testosterone, such as bone loss, increasing cardiovascular disease, increasing obesity, increasing metabolic syndrome, and potentially diabetes. So there are a lot of other complications that may happen as a result of low testosterone too. So that would be some of those misconceptions.